I'm talking to Dr. Richard Shaffer, an oncologist who treats Dupuytren and Ledderhose by using radiotherapy. Richard, can you tell us if people have had radiotherapy for either of the conditions and the condition seems to progress later on again, is it possible to have the treatment again?
Thanks, Anna. Good question. Obviously, when you have radiotherapy, what you hope is that the radiotherapy is going to keep this controlled in the long term. As I said before, sometimes radiotherapy just isn't effective at all, but sometimes it's effective for a number of years and then sort of restarts, and it may well be a totally new nodule that comes. The question that we have is, well, if that happens, if it flares up again, can we then use more radiotherapy to treat it? So, the first part of my answer is, if you, let's say you get your right hand done a year ago, and then you get it on your left hand, then absolutely, you can get your left hand done. No problem, no particular restrictions. It's a totally different part of you. And the side effects of radiotherapy are only in the area that we treat. So, if it's out of the original area, then we can then treat it. So that also applies. Let's say you get just that part of the hand and then you get something in your thumb, then sometimes we can just treat that bit. So that's also a possibility. So what I would call it out of field treatment, we would just use the normal dose, in other words, 2 weeks worth of treatment, and no problem. But the more interesting and difficult thing is, well, what happens? Let's say I get my right hand treated, I get the whole area treated, but actually one of the nodules starts growing again. Or maybe it extends up a finger that's already been treated, what would happen? That really depends on what's happened after the treatment. So the first thing to say is, did you tolerate it well the first time? Most people tolerate this very well. You might get some mild, redness and soreness of the skin that goes, you might get some mild dryness, but there are some people that find, for whatever reason, that their skin doesn't tolerate it quite as well. So that's something we have to take into account. If we're going to do this again, we need to know what it was like the first time. So that's the first thing. The second question is, well, how long after the original treatment is it? If, let's say, you have your treatment, you get a new nodule, and it's only 2 months after the treatment, then I would say, well, either radiotherapy just hasn't been effective, and to me, it doesn't necessarily seem sensible to give you further treatment if it wasn't effective in the first place. Or sometimes people just get these nodules that come and go, or sometimes, radiotherapy can give you funny effects. Things sort of swell up a bit and then they get better, or some of the soft stuff recedes a bit and it looks like something's more prominent underneath. We normally sort of see what happens for a while. So I normally say, look, if it's very soon after radiotherapy, definitely if it's less than 3 months, let's just watch and wait and see what happens for a month or two. But what I would say is, if it's at least a year after the radiotherapy, so in other words, you've had a good amount of time for any of the side effects to go, this is not just a radiotherapy sort of inflammation effect and so on, and your skin really has repaired itself, then I do think about potentially giving further radiotherapy. So let's say I treated the hand, you get a nodule here, I treated a wide field to start with so that I wouldn't miss out any of the disease. If you've got a new nodule that's causing you problems, and then we decide to go ahead with treatment, then I may well treat that nodule, but I would try and do a limited amount of the skin, because what I want to do is make sure that we don't give more side effects than we have to. When I repeat radiotherapy, I give 1 week. So the first time we give 1 week, and then we give a 3-month gap, and a further week of treatment. When I repeat radiotherapy, we only give the 1 week. That's certainly what my view is. Other oncologists may well do different things. And that's because, I just have to be quite cautious. Although your skin has repaired itself, it may well be more susceptible to radiation damage. So, I just don't want to do any harm to people's hands. The second thing to say is that although anecdotally, I've treated a number of patients and it seems that this is very safe, as have my other colleagues in other countries, there isn't anything written about it in the literature. And so therefore, I don't want to really push this when we don't know how effective this is. So I think, definitely I've had good responses to this, both in the hands and in the feet, in terms of, the nodule stopping growing, reduction in pain, or whatever it is. But I really feel we have to be a little bit more conservative So I just stick to 1 week. So certainly, we can repeat radiotherapy. In my view, once you've had 2 weeks, if it comes back in field, I just give 1 further week of treatment. I think that's sufficient.
Thank you.